There are two reasons. The first of which is that I work in acute cardiology, which is a very research-driven area. There is always some sort of research going on around the area in which I have my clinical practice. Secondly, I come from a unit which was a pioneer for a new way of treating heart attacks, which has since become nationally a standard method. This research has radically changed the way that our unit operates. Previously, we treated heart attack patients, often in a very nurse-led way, on the coronary care unit itself. Following the implementation of the research, we treated heart attack patients in a catheter lab. It completely changed the way that we delivered heart attack care, but we have seen the benefits of that to our patients and to their future lives. Because we'd seen positive results from implementing previous research, when we heard about this new study called Tea Time, which promised to look at ways of improving further our treatment of heart attacks so that patients who'd undergone a heart attack may not suffer from subsequent heart failure, we were really quite enthusiastic about that. That looked like real progress. Everyone, once they understood what the purpose of the research was quite enthusiastic and on board to take part in it. Our involvement in this study has, to a large degree, brought research back where it was, say, 10 years ago, back into the heart of our practice. It's led to us integrating the processes of research into our routine clinical practice and has, to a degree, demystified the role that research plays and the role that nurses can play in research, and has led to a lot of non-research nurses becoming enthusiastic and curious themselves about research. I think my role in the study was to act as the local champion and pull together lots of other people who were involved to make sure that it worked at our site. So there were, for instance, my colleagues at the original hospital involved in the study to get from them tips about what they'd done so far and what worked for them, what didn't work for them. It was to work with our consultants in the labs to work out the screening questions that we could ask before patients even arrived at the hospital. It was to work with our research nurses, our specialist research nurses, and it was to work with my colleagues to see the ways that we could collect the information for the study and integrate that as seamlessly as we could with the sorts of tests that we would do on post-heart attack patients anyway. I think in the end, we worked together extremely well as a team. We got the job done, and in fact, we became the second highest recruiting centre outside of the original hospital. And that's really pleasing, and in fact I'm looking forward to the next study that comes along. I think everyone learned a lot from being involved in the research, and I think the main lessons are that with enough support, encouragement and enthusiasm, you can integrate research into your normal clinical practice. And I think if, as we did, you can do research under the conditions of emergency admissions, then you can do research anywhere.